My name is Alissa. I am 35 years old. I am a full-time model, print and commercial model, and I am from Staten Island, New York. I was diagnosed with breast cancer 3 years ago on May 8th, 2018. The reason why I decided to get breast reconstruction from the very beginning is because I wanted to still feel like myself. So I feel like that was already a decision that was made once I had heard I had to get a double mastectomy, once I had the BRCA gene diagnosis. There was never an option for me to not reconstruct. I feel amazing about it. I couldn't be happier. I feel like honestly, I feel like I look like myself again. Many things have changed physically and emotionally, obviously, through this journey, but now I feel just like I was able to get a hold on getting back to me, like the power of myself. So when I started considering fat transfer and I spoke to my plastic surgeon, I was really excited for it because I didn't even know that would be an option. He was explaining that fat can be transferred from the leg area, the side of the legs, and it would just be literally like a liposuction procedure where they would take it from the sides of my legs and just put it in the chest area over the implant. So I was really excited once I heard about that, and I went through my first fat grafting transfer a year ago, and I'll be undergoing my second in 2 weeks from now. So I'm really excited to be doing that again. What has happened to me, many would say is a tragedy, but I found that it ended up becoming a triumph for me in a way, especially with the business I was in. I was really looking at myself not in the way that I should, not with love, not with gratitude towards my body or love, really. What I've learned about my body while going through this and continuing to go through this is to really be in my skin and be present. I'm much more comfortable now that there's many changes that go along with breast cancer and the treatment. But what I learned was the power of the human body and how strong I really am mentally, physically, emotionally. It's really built me up in a major way, and I'm so grateful for that. The reason why advocating for breast health is important, because women my age don't really think about it, because we don't really have to, or our doctors make us feel like we don't really have to think about it until we're in our 40s. And it just goes along with, just being on top of your health and being in tune with your body. Also becoming a resource for women in going through this has been my life. Like now I'm realizing why I'm here. This is my purpose, and Natrelle gave me my purpose. I really didn't know what it was before this. Before this, I was just worried about what I looked like in photos and videos, and now I matter to people and I make a difference, I feel like, and so that's immeasurable. When I speak to women that are considering breast reconstruction, I basically answer all their questions first, but then I tell them what my experience was so they can kind of take from that, and then whatever questions they may have, or I like to like prepare them mentally for what will come. So like that first moment of taking off your bra after a double mastectomy. What is that going to look like? What's that going to feel like? Do you want to know? Because I want to tell you if you want to know, because I feel like it's great knowledge to have, and I wish I had that. So the piece of advice that I would give would really be just, trust that your plastic surgeon is going to do what's best for your body. And just really, hopefully you have that connection with them. And if you don't, then don't feel shy. I've heard from women so many times like, oh, I feel embarrassed to change plastic surgeons now. I'm not quite comfortable, but I feel funny. It's your body, you have to be in it, this is you. So if you feel uncomfortable for any reason, that's your intuition and you should listen to it. What I know about myself today that I didn't know about 3 years ago would be my resiliency. I had no idea I had this level of resiliency inside of me. That's definitely one thing that I'm impressed about, but with myself.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.